to the big conversation point, the number 2 conversation point here. 6 cases of the mutant, the UK strain of coronavirus have now been detected in our country. So officially, the UK variant, the one that transmits easily and infects easily and faster, is here in our country. So far, 6 samples of those who returned from United Kingdom have tested positive. Now, 3 of these samples that were tested in the NIMHANS lab in Bengaluru, 2 of them in the lab, CCMB lab in Hyderabad, and 1 that was tested in NIV in Pune has tested positive. Remember, about 114 people so far who've come back from United Kingdom have tested positive for COVID. But of this, 6 of them showed the new strain after the genome sequencing test was done. Now, the government says that those with this infection have been quarantined, that the contact tracing has been initiated for co-travelers, and that enhanced surveillance and containment will have to be done in and around the places that these people may have visited or people they may have come in contact with. We still don't know the details of who they are or which states they are from, how much have they managed to move around, or were they immediately once they landed at the airport, were they pulled out, and that's where we managed to detect it itself. These are the questions, the details are still emerging. But tracing the UK returnees is still one of the big concerns in our country right now. Remember, it's only after it became a huge story worldwide and across the world we started seeing countries shut down their borders to people traveling from United Kingdom did we suspend our flights on December 22nd starting midnight. And for a day before that, we said we will start testing whoever is coming. But now we have to trace back and we have to find people who in the last few weeks may have come to our country. And of those, many of them remain untraceable. 17 of the 811 who came to Rajasthan are untraceable. In Karnataka, it's actually a bigger number. 250 are untraceable of the 1,600 odd who returned to Karnataka. In Andhra Pradesh, of the 1,363 who returned from United Kingdom, there are still 17 that the government has not managed to trace right now. In Odisha, 62 of 181 are still untraceable, which means that the addresses and the numbers that the government has of them aren't where they're able to reach out. So these people are still out there, maybe unaware that they may or may not have this strain. What do we need to do? Are we doing enough? The government says there is no evidence to suggest that the vaccines which are in the pipeline won't work for this new strain. But that's later. The vaccines are yet to hit the markets. What is important right now is the level of testing. So yes, now there will be genome testing for all international passengers who show the symptoms and test positive for COVID. That's the new rule that has been brought in. The government is asking people to not let their guard down. And so once more, at the cost of repetition, but it is required as we head towards the new year and we feel a sense of excitement and hope that 2021 will be better, that we can step out. The lockdown's not there, we can meet people, we can socialize and we can party, we can travel. If you're having those thoughts, please keep in mind the fact that the dangerous COVID virus is still out there and you cannot let your guard down. I say good evening to Dr. Shahid Jamil, Director for the Trivedi School of Biosciences at the Ashoka University. Professor Tanvi Krishna is a Professor of Molecular Parasitology and Medicine, Infection and Immunity Research Institute at St. George's University of London, and Dr. Giridhara R Babu, Professor and Head for Life Course Epidemiology at the Indian Institute of Public Health, also joining us this evening. So great to have all of you with us this evening. Dr. Shahid Jamil, let's start with you. What should be the key things we keep in mind? It's official now, it was inevitable, but now we know that this more infectious strain is in our country.
Well, I would have been surprised if it wasn't there. Yes, we put restrictions at the airport, but in the long run, these kind of border restrictions have very limited utility, and they will very quickly show diminishing returns. I think what's important is to be proactive and not be reactive in these things. And we have continuously been reactive. So, for example, India was only sequencing at a rate of 0.05%. And suddenly we are now saying everyone who tests positive will be sequenced. We will take our sequencing to 5%. We'll suddenly increase the sequencing hundredfold. The question is, we should have been a little proactive and would have sequenced more, as many of us were saying, but that was not happening. Now, as you yourself said, it's going to be very difficult to trace people. And remember, you're trying to trace people who came in the last 1 week, 2 weeks. This variant has been circulating in UK since the end of September. It was first detected in UK in November. That's when we knew. So between November and now, uh, thousands of people would have traveled from UK to India. How are you going to trace the contacts of everyone? So I think this is yet another time when it should be emphasized that we be more proactive rather than reactive in these situations. Yes, closing airports shows that we are doing something, but the question is, are we doing the right thing?
Yes, there's a very valid point that you raised, and let me in fact take it across to Professor Sanjeev Krishna. Professor Krishna, the fact that obviously we may have started reacting to it around December 20th, but the virus was already there. People were already traveling in large numbers, so we've already had it for a while, and we're moving now slowly to test it. While we test, contact trace, isolate, should we go into, or should we remind ourselves that we need to stay away from each other, take all the necessary precautions? Just how aggressive does our government strategy also need to be?
Well, first of all, thank you and good evening to you and your viewers. It's so nice to see my colleague Shahid as well on this program. Look, I think the points Shahid has made are absolutely critical. So just to remind ourselves, you do need intensive sequencing so that you can map what's going on. Yes, you're absolutely right. And it is critical that all the measures that we know work for any strain of COVID-19 to control its infection, social distancing, masking, hand washing, and so on, all these should be reminded, the population should be reminded of them, and they should be supported. But, the other point is that when you look for this strain, you sometimes, if you go to South Africa, for example, they have their own homegrown variety. And you go to Belgium, you go to Germany, you'll pick up this strain for the reasons that have already been discussed, and also because we know viruses do mutate and mutate quite quickly sometimes. So there may be a homegrown variety. We don't know. What needs to happen is intensive sequencing in relation to other epidemiological studies that are already underway, relating to transmission, for example, relating to the risk of disease severity, looking, for example, at the potential on what a vaccine efficacy might be, and so on. So far, things are reassuring, except with one feature, that the transmission rate is much higher. And because of that, the vigilance and the application of control measures has to therefore increase correspondingly.
Okay, interesting point that you have raised there. And, the general sense is, or one wonders, Dr. Babu, that the kind of attention that we had, the kind of guard that we showed, an initiative that we showed in the first few months, are we doing the same level of contact tracing now and surveillance now? In most of the states, before the conversation about the new strains, contact tracing pretty much had just vanished and died out. It was pretty much about you and your own family isolating if you are tested positive. Do we need to remind ourselves and re-energize?
Thanks, Tanvi, for having me on this show, and good to see Dr. Shahid and also Professor Sanjeev on the show. So you're right. The contact tracing has been a weak point in most places, especially in the metros where there is a deficient manpower which is required to do the contact tracing. Also, there are many people who have been drawn from other departments. They are no longer associated with the health department, and therefore the contact tracing has become more of a problem. But going by, again, the points raised by Dr. Shahid and Professor Sanjeev earlier, we need to be guided by evidence. And today, Public Health England has released an update. And one of the things which we need to consider is the recent update suggests that there is no difference between the people who are infected with the new variant and the other variants in terms of hospitalization, fatality, or even reinfection. So therefore, this evidence should help us in terms of, and their secondary attack rate is the highest among those with the new variant. So therefore, contact tracing becomes even more important with the new variant strain. As Dr. Shahid clearly explained earlier, this strain has been going around in circulation since September. And in India, many people have traveled to and fro from India and UK and other countries. So we need to be also looking at if there are any missed outbreaks, which doesn't explain the data trend. And if it is there, we need, and some of the samples stored, we need to be going back and then seeing whether we can isolate the strain as well.
Actually, that's a very valid point that you've raised, and Professor Krishna, if you would like to comment on this part, that while yes, this variant does transmit easier or faster, there is no evidence yet to suggest it's more potent.
Yeah, I think you've put it very well, because we are in the process of getting the information as well as analyzing it. And this process is going to be carrying on, and our ideas and thinking may change. But so far, you're quite right. The evidence suggests that the behavior when the virus infects somebody in terms of how that individual responds is not going to be changed significantly by this variation. We know that if you look in the lab, for example, one region which interacts with the way the virus attaches to the cells, may be interacting more strongly with the receptor. But I think overall what's important is very much the risk of severe disease in patients. But we mustn't forget one very important broader point, and that is that if the virus is transmitted more quickly, more readily, then more people are likely to be infected. And so the overall numbers will be very much larger unless stronger measures are taken to contain the infection. So even if the risk to an individual remains the same, if the population is much larger that is infected, then again, health services are going to be seriously challenged, as we are seeing now with the tsunami here in the UK.
Yeah, actually, then that's the point. And for a country like ours, with the kind of density that we have, we always need to be on our toes about how many people we may end up getting infected because of this. So let me ask this question, and I'm obviously not trying to put you in a fix, Dr. Jamil, by asking you what the government should do policy wise, but there is a lot of conversation that everybody is having about should we send our children to school. Some of the states did say that from the first week of January they will allow schools to reopen to a certain extent and children to come out. Should we be cancelling our travel plans again? How should the common person be right now planning their new year?
Well, how can schools open when Parliament doesn't? It's a very, very simple answer. I mean, is it safe for children to go to school while it's not safe for MPs to go to Parliament? Let's think about that. And what should the government do? I think the broader point is that evidence-based policy making is important, and evidence has to be gathered in real time in a pandemic. And you can only gather evidence in real time in a pandemic when you are proactive. And that's the point I made earlier. You can't be reactive and keep chasing contact tracing and all that. It's practically not feasible in a country of India's complexities.
Correct.
So I think the point right now is let us not panic.
Right.
Yes, it's transmitting. It's more contagious, but it's not more lethal. And I also feel, and maybe Giridhar will say more about this, that India possibly already has about 30% overall infection. And it's possible that, a variant like this may cause infection, but may not cause as much disease. So we will have to see. But I would say let me not be let me not indicate that people can be complacent. We need to maintain all the non-pharmacological methods, which is masking and sanitization and distancing, now as well as when vaccines come. I think pretty much all of 2021 will have to follow these protocols.
In fact, since you raised the point of vaccines, and the government in its weekly news briefing today also spoke about it, and the secretary said that, well, the current vaccines which are there in the pipeline would be used against against the new variants as well. Dr. Babu, is there evidence to suggest that yes, it will work? I mean, one is, of course, we are still in the process of giving them approval for COVID in general, but against the new variant?
Yeah, so there are 2 points I would want to mention in response to Dr. Shahid sir asking me regarding the threshold for population immunity.
Yeah.
I do believe that the dense pockets, at least in the metros and the major urban cities, are probably having higher threshold of population protection. So therefore, since UK, if you see the kind of spike that the UK is witnessing now, if the new variant had to spread in India, we would have definitely had a greater surge in cases. So having said that, regarding the vaccines, we are not really sure, because I am yet to see the results of phase 3 from the indigenous vaccines, both which have been much discussed about. So therefore, I can't really comment on the safety and efficacy, but I do believe that at some point of time, they will be made available.
Yeah.
But the point is that, and I really like the explanation given by the government today, where they said it is more like polyclonal kind of antibodies against the spike protein. It is not just about one or two aspects of so S protein. So therefore, any vaccine that is been looking at a broad spectrum coverage of the spike protein should be able to protect theoretically. But is that really true? The UK study, which is being done now, will give us more details in terms of whether that is true or not. But the last point, of which both the other panelists are the experts, but the way I understand it is, the virus will try to survive by making modifications itself.
Correct.
So it is modified in such a way that it is not killing people, but it is spreading among more and more people. It has to survive. So therefore, will it keep doing these modifications in future, compelling us to even change our vaccines from year to year, just like flu? I don't know. We'll have to wait and see.
Is that a wait and watch kind of an answer, Professor Krishna? Would you agree that, well, we would all need to wait and watch?
Yes, I mean, let's not forget, It's been less than a year, or almost a year, since the virus was first identified and then sequenced. Look at where we are now. Right now, apart from the measures that are already in play, which we've discussed, right now we are really seeing now a race between infection and injection, as we say. So the best weapon that we would have is a vaccine which is effective. And I would agree that the chances are, because vaccines currently are designed against the whole of the spike protein, and what we're seeing here are patches, very small patches of changes, which make these differences, for example, in transmission, that the probability is very high that the vaccines that we have, whatever their mechanism, however they are derived, are likely to work. Of course, the best test will come when people have had the vaccine, and then if there isn't a risk of reinfection in those people, what is the sequence of the virus in those people that are reinfected? So that will tell us what's happening in people. But right now, we're very optimistic that the vaccines will work. And the challenge is getting them out there, at least here in the UK and in Europe and in the States.
Yes, across the world, that will be, the next big challenge once we've gone through our due diligence, even in our country, and when the approvals come in, how to roll them out and get to the peoples and ensure that those who need it the most get it first. Thank you so much to all three of you. It's been a very enlightening conversation with all of you, the experts here on the panel. So very quickly for our viewers, understand that there is no need to panic, but yes, of course, it was inevitable that even this new kind of the mutant strain of coronavirus will come to our country. It has already. The numbers may increase in the coming days as we do more and more of testing and contact tracing and surveillance. That's going to be the government's challenge, and they need to really ramp that up. We are already behind schedule. We said this earlier as well. We started a little late. By then, so many people, hundreds and thousands of passengers had already entered our country. And now we need to go back and check if they were carrying this virus and if it is spread. On your and my part, we need to continue taking the precautions that we are and hope that the same vaccine that we are looking at currently, when it hits the markets, it really works on all kinds of COVID infections and the mutant strains. Also keep in mind that it's still a very, very new virus. So across the world, scientists and researchers are constantly 24/7 looking at data and studying this virus and trying to understand. But there is so much still that we don't know, and hence we shouldn't take for granted. Thank you for joining us.